Let me ask you a simple question. Which department in a hospital can decide between life and death within minutes? The answer is the emergency department. Every day hospitals receive road traffic accident cases, heart attack patients, stroke patients, poisoning emergencies. If the emergency department is not properly structured, it can lead to serious patient safety risks. And during NABH assessment, this can result in major non-conformities. That is why NABH created the COP-2 standard for emergency services. What you will learn in this video? In this video we will clearly understand what NABH COP-2 standard says, what NABH assessors check in the emergency department, common mistakes hospitals make, and how hospitals can easily become COP-2 compliant. So let's begin. What is COP-2 standard? The NABH COP-2 standard states, emergency services are provided in accordance with written guidance, applicable laws and regulations. In simple words, hospitals must provide emergency care based on defined SOP, clinical protocols, legal requirements. The main objectives of emergency services are immediate patient stabilization, life-saving treatment, safe referral when required. What assessors actually check? When NABH assessors visit the emergency department, they verify several critical elements. They check emergency department layout, availability of trained staff, emergency equipment and drugs, triage system, emergency SOP, documentation and legal compliance. They verify this through department visit, document review, staff interviews. Identified emergency area. Every hospital must have a clearly identified emergency area. The emergency department must be easily accessible, clearly marked with signage, operational 24/7. Patients and visitors should be able to find the emergency department immediately. Emergency department layout. Ideally, the emergency department should include triage area, resuscitation area, treatment area, patient holding area. Hospitals should also define the minimum number of emergency beds according to their scope of services. Emergency resources. Emergency departments must always be equipped with trained doctors and nurses, resuscitation equipment, vital sign monitors, emergency drugs, essential consumables. These resources are necessary for immediate life-saving care. Emergency staff training. Emergency staff must receive regular training such as basic life support, BLS, advanced cardiac life support, ACLS, trauma management. This ensures the staff can respond quickly and effectively during emergencies. Emergency crowd management. One common problem hospitals face is overcrowding in the emergency department. NABH requires hospitals to develop systems for crowd control, such as footfall analysis, adequate staffing during peak hours, security arrangements. This ensures safe and organized emergency care. Attendant management. Hospitals must also implement attendant control policies. Examples include limited attendance per patient, controlled entry to emergency area. This prevents chaos and maintains a safe treatment environment. Emergency SOP. Hospitals must have written SOP for emergency management. Examples include protocols for road traffic accident management, poisoning management, stroke management, acute coronary syndrome. These protocols must cover both adult and pediatric patients. Medico-legal cases, MLC. Emergency departments frequently handle medico-legal cases. Hospitals must clearly define what constitutes an MLC, documentation requirements, police intimation process. Proper documentation is essential for legal compliance. Triage system, very important. One of the core requirements of COP-2 is the triage system. Triage means prioritizing patients based on the severity of their condition. This ensures that critically ill patients receive treatment first. Triage must be conducted by trained staff using evidence-based criteria. Pediatric triage. For pediatric patients, hospitals may use tools such as Pediatric Assessment Triangle, Pediatric Observation Priority Score. These tools help doctors quickly identify critically ill children. Reassessment of waiting patients. Patients waiting in the emergency area must be periodically reassessed, because their condition may improve or deteriorate. This reassessment must always be documented. Documentation of patient outcome. Hospitals must document the outcome of every emergency patient. Examples include discharged home, admitted to ward, short stay observation, referred to another hospital, transfer or discharge note. If a patient is discharged or transferred, The hospital must provide a transfer or discharge note. This note should include clinical findings, investigations performed, treatment provided, patient condition at discharge. Emergency Quality Assurance Program. Hospitals must implement a quality assurance program for emergency services. Examples of quality indicators include return to emergency with the same complaint, mortality rate, waiting time. This data helps hospitals identify improvement opportunities. Common NABH non-conformities. During NABH assessment, common COP-2 non-conformities include emergency SOP not available, triage system not implemented, incomplete documentation, unclear MLC procedures, missing emergency quality indicators. Hospitals must address these gaps to avoid assessment observations. How hospitals can become COP-2 compliant. Hospitals can comply with COP-2 by developing emergency SOP, implementing a triage system, training emergency staff, establishing MLC policies, monitoring emergency quality indicators. These steps help hospitals meet NABH standards effectively. In the next video of this NABH training series, we will discuss COP-3, ambulance services ensure safe patient transportation with appropriate care. If you want to learn NABH standards step by step, then like this video, subscribe to the channel, turn on the notification bell, so you never miss upcoming NABH training videos. This is MediQuality Partners, your trusted NABH guide. Thank you for watching.